Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Thursday, November 18. I know I told you we maybe weren't going to be on today because we're doing a lot of extra outreach for City of Chicago employees, but here we are. So this is your chance, as always, to get your COVID questions answered. You can put your questions directly into the box below, or you can use the hashtag AskDrArwady on either Facebook or Twitter. As you see, we have a special guest today. Really pleased to welcome a new person to Facebook Live. This is Red Mansour. He is the Director of Innovation at the Chicago Department of Public Health. And Red, you've been with the city, longer than I have, more than 8 years?
Correct,
yeah.
Yes.
And really, in our innovation space, Ryad has the job of trying to move things ahead, sometimes without a lot of resources, but has really been part of a lot of the most interesting new things we've been doing at the health department. Long before COVID, things like predictive analytics. How do we actually do a better job of predicting, where a child could have lead poisoning, where we might have issues related to food outbreaks, any of these issues. But then during COVID, he did even more of this. So maybe tell folks just a little bit, because it's a COVID call, a little bit about what you were doing behind the scenes during COVID.
Sure. Thank you for that introduction.
Yes.
We were tasked with how we can modernize to keep up with COVID and the population, especially early on when we didn't have a vaccine and the tests were not readily available. So we created the Shy COVID Coach, which helped people log in their symptoms so we can get a better idea of what's going on. But we also got ourselves up in the cloud at the same time. And
first time, City of Chicago, finally. Data in the cloud. Secure, easy to access, speeds everything up, helps with the dashboard.
Yes, and it was very flexible, what we needed, especially if people needed to work remotely. That was very important. But we also integrated text messaging, which was also a first for the department. And we can now text out to our residents and people that were registering on the application. But then it extended from there, and we needed to improve our case investigations and contact tracing. So we moved to a more modernized system, also on the cloud, and it was the first time also to take contact tracing there, especially mobile and flexible, especially when we connected another system, the vaccine clinic management system, into that, especially with our public health nurses and our CDPH staff that were working in the mass vaccination centers. So we needed it to be flexible, mobile, on the fly, and we did that in a matter of months, which usually would take a year or longer.
Exactly.
We corralled the forces of CDPH, and it's not just me, there were a lot of people involved, but we were able to accomplish that. And now, since I'm off those projects, that version 1.0 is probably version 20 now.
Yeah, absolutely.
So the teams have done great to continue with that innovation on their own. So they keep the ideation and how can they do better for the people of Chicago.
Absolutely. And so as you've heard me say, virtually everybody at the Chicago Department of Public Health got pulled almost 100% into COVID. We tried to keep out a lot of our behavioral health folks because we knew there were going to be increases in needs for mental health, substance use, violence prevention work, and also a lot of our kind of environmental inspectors, a lot of that sort of continued. Even they, though, were part of COVID responses in particular ways, and almost everybody else early on just stepped up in so many ways. And it really has modernized in ways that were really necessary. A lot of the infrastructure you don't see. And my hope is that really in a more long-term way at the national level, as public health hopefully gets some more sustained investments, we'll have much better IT and informatics and sort of data support that helps keep everybody's data private, but make sure that we can respond and get folks back in line. But then, as the response has matured, as we've been able to hire additional folks and bring folks in, we have been able to move many people more back to their original jobs, although COVID certainly continues to touch everything we do. So can you tell us a little bit about some of this work with tree equity that you've been doing more recently?
Yeah, it was a great transition, because during COVID, a lot of people were coping by going out to nature, to parks and the forests. It decreased stress. And one of the things that was pre-COVID, I became a tree keeper, and then COVID started.
Wait, what's a tree keeper? They don't know.
Yeah. So if you go to Open Lands, they're a regional conservation organization here in Chicago, and they offer a certification so you can learn all about trees, taking care of trees, and planting trees. They're the only organization in Chicago that is allowed to plant with the Bureau of Forestry on the Parkway. That's the strip of grass that's right by the street there. They offer opportunities to volunteer and plant trees all across Chicago, and the parks too, and Cook County Forest. So I became a tree keeper, and then COVID hit, and I did go out to nature to relax, and there were a lot of beneficial things happening to health, and mental health and physical health with regards to getting out to nature. So I researched more, and we had a Bloomberg award that was looking at different aspects of collecting data to look at the state of air quality and health in Chicago. And I thought, this could be something, instead of just making a map, maybe we can develop a tool that we can use internally in the city to prioritize census tracts for communities that are more in need, that were under-resourced in the past. How can we be better at improving tree equity? But also for communities to use. We're piloting this right now, and there's a lot of interesting use cases that are developing out of this pilot. But it doesn't tell you what kind of tree, it doesn't tell you exactly where on the block to plant it, but it narrows it down to the census tract. So it wasn't only trees. And let me just say, we did this with our partners, Bloomberg Philanthropies, but Vital Strategies, and the University of Chicago Center for Spatial Data Science, Dr. Marinia Kolak, shout out to her, and the teams at the mayor's office, the sustainability office, Angela, Kyra, Gabby, and infrastructure with George, and Jacob from Bloomberg. So, we initially took health equity measures, and interestingly enough, they intersected with tree equity.
So what does that mean? Give me an example.
So we looked at asthma.
Yeah.
And we collect asthma data. It's on the Chicago Health Atlas. And the Chicago Region Trees Initiative gave me tree data. Basically, it's called LIDAR, light detection and ranging. It's like radar, but it's pulse laser. You can fly a plane, shoot pulses, and it does a 3D image of the land cover. And some smart people take out everything else but the trees. And now we can get tree canopy coverage. And they found in the research, but when we added to this tool, there were some correlation experiments done to see how related it is to asthma, and there was a correlation. So we found low asthma with high tree canopy. And then we started using other public health measures. We looked at social vulnerability index, the ability to see some of these external factors that make someone vulnerable that can affect their health. There was another connection there. We used hardship index, which looks at education and income. And again, it started correlating. We looked at PM 2.5, we looked at traffic, we looked at flooding, and surface temperature was really strong.
Related to the climate change work.
Exactly.
Yeah.
So when you look at all these public health measures, and then you take an environmental measure, what we call health equity, easily transferred to tree and health equity in this tool. So it wasn't about looking at neighborhoods or census tracts that had just low number of trees. It was low number of trees plus these. And they're easy to use because you can, use the tool to put as much emphasis on any of those measures as you want. If you're interested in climate change or the environment or health, you can basically make your own index. We're piloting this with community organizations that work around the green space. So on the ground, and we're getting some good feedback from the way the tool is being used.
All right, great. So again, this is the sort of thing that I think people don't always think about when they think about public health and what is the work and how are we trying to think about pulling data together, not just to admire a problem, but to really do something about it. And with the ARP, the American Rescue Plan funding that the city of Chicago has received, there's what, 46 million, is that right?
Yes.
That the mayor and the teams have really decided to put toward trees and wanting to make sure that we were in a place to not just plant those trees here, there, and everywhere, but to really be very focused and thoughtful about, from a climate change perspective, from a, homes are more valuable when there are trees near them, from a health outcomes perspective, how do we make sure those investments are really reaching across Chicago and getting to where they need to be? So let's take just a quick break. I do want to obviously make sure we look at where the COVID numbers are, and I've got a few slides to show you. Red, I'm going to ask you to also talk through a couple of slides for folks, just so they can see some of these tools and what we're doing, and then we'll come back. Obviously, we'll take your COVID questions, but also where you have questions about trees and about this kind of work, who it is, how you can be involved. That's sort of the goal. So let's check out chi.gov/COVID-. As always, this is where you can see what's happening with COVID numbers in Chicago. And you can see that in terms of our outbreak, the numbers are not good. We are averaging now 501 cases per day. You can see on the graph here that is going up quite a bit, up 18% from a week ago. We're currently averaging 18 cases per 100,000 per day. And although that is well under the national average, which is currently 27, it is much higher than we were even a few weeks ago. And where you look at some of the states around us, Michigan, Minnesota, their daily case rate per 100,000 is over 70 and sometimes even over 80. So we're seeing outbreaks even 4 times what we're seeing here in Chicago, quite nearby. Hospitalizations, we're averaging about 25 Chicagoans being newly hospitalized with COVID every day. It's about stable from a week ago. Deaths are up again, 4 deaths a day. We're doing a lot of testing, 22,000, and in that setting, our positivity is 2.7%. That's still a good positivity because testing is so good. Remember, positivity is the percent of positive tests out of all the tests that are done. But the fact that you are seeing both cases increase and positivity increase tells you that this is not just a testing artifact. This is truly more COVID in Chicago. The number that is in green on here is our vaccination number. I'm really pleased about this. Almost 13,000 vaccinations per day, every day right now. And on Tuesday, we did a big press conference. I was absolutely thrilled with last Friday's outcome, the Protect Your Health on the 12th. We had more than 20,000 vaccinations in one day. If we blow this up, you can actually see this one day sticking up really high. That's the most vaccinations in one day, 20,546, that we had done all the way back to May 15. So broke a 6-month record, the most vaccinations that had ever been done for kids, teens, or younger children in the city, and a really good boost in terms of those vaccination rates. Also much better outcomes, which we shared, with more uptake for some of the less represented kids, many more Black and Latinx kids getting vaccinated on that day, for example. And we really needed to see that because we were seeing more white children in Chicago getting some of those very first vaccines. And my worry is that where we still have less vaccinated networks and communities, that's where COVID continues to spread. So pleased with the vaccination numbers overall. Obviously, we're continuing to push hard on that, but we are absolutely in the middle of this COVID increase. Not a surprise as we head into winter. Let me just pull up some slides to highlight a couple of things, and then, Rad, I'll hand it to you. So in terms of what this looks like in our numbers overall, we are in the high transmission risk range for cases. Our test positivity remains in the lower risk range just because testing is so good. But just since yesterday, our hospital COVID numbers are now back into substantial transmission, moved up from lower transmission, because we now have 256 Chicagoans on average hospitalized with COVID each day across the city. Our ICU numbers are still looking pretty good, just 60 Chicagoans in the ICU. And most of that is because our most vulnerable folks, our oldest folks with the underlying conditions, are largely vaccinated. But boy, those hospital numbers worry me, and the huge majority of those folks are unvaccinated. Where we are seeing some breakthrough COVID infections, although they're rare, they are more likely to be in Black Chicagoans because there are more people in the networks who are not vaccinated, sometimes more underlying conditions, and especially they're older. I emphasized this a lot on Tuesday. We showed you that data. A lot of this increase has been in people over 65, and it's why we want everybody over 65, no questions asked, please get a booster shot if you have not already done so for COVID, as well as people with underlying conditions or people in higher risk settings. Our dashboard now does include vaccination rates for the city's population over the age of 5. I encourage you to explore that. This was that beautiful uptick in the first dose uptake for 5 to 11-year-olds. You see in green here, that's our 5 to 11-year-olds. And that popped up nicely with our Protect Your Health on the 12th, and then actually has stayed quite high here. So we're ahead of the national uptake there. Nationally, it's about 10%. We're at about 15%. Still a ways to go, but very pleased with that. And then importantly, with a lot of this push this last weekend, this is what I was saying, you know, we've seen a very high uptake always among white non-Latinx Chicagoans, but we saw really steep, the best increase actually among Latinx Chicagoans, up almost 200% this last week compared to the week before for first doses, and up over 100% in purple here for Black Chicagoans, and then up about 100% for Asian Chicagoans. So pleased to see that. It's where we most need progress. Reminder, I know we emphasize this, but right now is the time to get vaccinated for the holidays. Even one dose before Thanksgiving, although we're within that 2-week range now, it does start to build protection. Sooner is going to be better. And children or adults need a first vaccine dose if they're going to get Pfizer, and for kids they can only get Pfizer. They need that first vaccine dose by this Saturday to be fully vaccinated in time for Christmas. So you can see here highlighted, November 20th is the date for the first dose of Pfizer. For adults, you can get a single dose of J&J by December 11 and be protected. And then we've got the numbers on here for Kwanzaa. November 21st would be the first dose for Pfizer for Kwanzaa, and then for New Year's Eve, November 26th. So right now, this week, I am worried if people think I just want to wait a few weeks, I want to wait a few months, I want to see, because A, we're in a surge, B, I expect there to be some more transmission associated with holidays, especially where people who are not vaccinated are gathering. So please take advantage of this now. Lots of availability at our city-run clinics. We are as you know, every Saturday and Sunday for now basically through early to mid-January, with the exception of the weekends of Thanksgiving and Christmas, we're offering free vaccines. This weekend we are at Kennedy King College as well as Olive Harvey College. You see the superhero. I think we've got capes for kids. We're really doing a lot to promote vaccinations for 5 to 11-year-olds, but please know any age can get COVID vaccines at this. We can give you a booster. We can give you J&J if you're an adult. We can give you Pfizer, first dose, second dose, booster doses. There are not incentives available for booster doses. For people getting first and second doses, there are. There is plenty of availability Saturday and Sunday. You see the 2 dates there are 3 weeks apart. And so encourage you to book an appointment. You can go to chi.gov/COVIDvax or that direct address, or as always, you can call 312-746-4835. Lots and lots of vaccine events happening this weekend. You can go to, everything is at chi.gov/COVIDvax, but otherwise chicago.gov/vaxcalendar shows you where we're going to be. There are a number of CPS events at various elementary schools and high schools again this weekend. The colors here show the different regions where the events are happening. Obviously, CPS is doing a lot. You can see we're at a McDonald's from 11 to 3. There's a whole host of places that are available just this weekend, in addition to, of course, all of the availability at pharmacies, at federally qualified health centers, at clinical sites. So no excuses. You can get a vaccine. There's lots of availability. Here's even some more. So they don't even fit where we're like Friday, Saturday, Sunday. You know, here's some more opportunities. You can see food pantries, Bricktown Square Mall, which continues to be a good place. There's a turkey giveaway that Instituto del Progreso Latino is doing on the west side. Feed a Teen Thanksgiving dinner, 1 to 5. We've got, even on Sunday, House of Many Blessings Thanksgiving dinner. There's flea market, Swaparama. Lots and lots and lots of opportunities. You can walk into a pharmacy, especially if you're an adult. There are also, Walgreens is doing another day of pediatric COVID vaccine clinics specifically. We had such good uptake at pharmacies this last weekend that from 9:30 to 4, Walgreens has added pediatric vaccinations, no cost. At Walgreens, parent or guardian does have to be present for the child to be vaccinated, 9:30 to 4. We do need you to make an appointment for that. So there's information on chi.gov/COVIDvax. That's just to make sure that you can, that the vaccine will be available. But please, you know, thanks to Walgreens and so many others for continuing to stand stuff up. Right now is the time. Don't put it off. Get a booster, get your kid vaccinated, and anybody who hasn't had a first or second dose, now is the time. Also just wanted to call out VaxOnlyChicago.com. The Chicago Independent Venue League is listing Chicago venues that are providing proof of vaccination for entry. I've had the opportunity to go to a lot of events these last few weeks. It's been great. I, before COVID, went to probably a theater or live music event of some kind probably twice a week. And so it's been great to be in small venue spaces, large venue spaces, theater, opera, symphony, you name it, knowing that everybody's vaccinated, knowing that masks are there. So thanks for that. All right, Ryad, why don't you go ahead and talk us through the tree equity tool, and then we'll get into your questions.
Sure. We'll go by this real quick here. Oop. There we go. So basically, this is the LiDAR data that I mentioned earlier, that pulse laser. It picks up big trees and little trees, but not every tree. And you can see here, it's not only in the parkways, the public parkways or the parks, but it's also across the city.
The green there is where there's a tree?
Yeah,
okay.
Where you see these little green dots. And you can zoom in and see the individual block and see where they're at. So we took that data, and if you can see some of those dots are bigger than others, that is a surface area calculation that Marinia has done that aggregated that to a tree canopy. Oh, let me keep pressing the wrong one, sorry. There we go. And you see that aggregated by census tract, and it's that tree canopy coverage. Basically, the canopy is the top part of the tree, the leaves, and the more leaves the better. So the older the tree, the bigger the tree, the more the leaves that are there, so that's more surface area, and that's the powerhouse of the tree. That's where the tree does a lot of the good that we talked about earlier. So you can see, you can look by community, all 77 communities, but you can zoom into those communities too. And this is some of the data we used. All of it's public and openly available. And so, you know, Chicago Region Trees Initiative, of course, but city-owned properties from Department of Planning and Development, IDOT, the traffic volume, CMAP for flooding, NASA for surface temperature. PM 2.5 came across a lot of different open source data.
And what's PM 2.5 again?
That's the particulate matter, 2.5 micrometers. It's very small. Think of very fine dust. It's I think 70 times smaller than the diameter of hair, I think, something like that.
Dust in the air, places yes. where we're seeing a lot of that. Can be
you
bad
get it
for
from
health.
Cars, you can get it from pollen, it can be construction, but it could also be industry too. Mm-hmm. So that was some novel work done also by Marinia over there at University of Chicago. Economic hardship is another index, social vulnerability, and asthma. We got this from IDPH, but you can find it on the Atlas too. So the data is readily available. We just brought it all together into one platform. And you can see here how you can start shifting these levers. Like if you want to look at less than 20% tree canopy, but you want to see where there's high social vulnerability and flooding and economic hardship, it starts taking away the census tracts that you don't want to look at, and it starts highlighting the ones that are exhibiting this tree equity issue. So you can see here, you can start prioritizing by community, depending on where you put these levers. You also can look up your own community, and if you wanted to see, if you're a community organization that is looking to plant trees in Austin, you can just look up Austin. You can see the tree canopy there. But some parts of Austin have more trees than others, so a good place to begin would be where there's most need. And you can do the same thing as you did with the rest of the city and look at different measures, so you can isolate the census tract that is of most concern. And here in Austin, you can see that it's the bottom half right here. So this is probably the best place to start. Yeah, exactly. And there's other scenarios. You can play around with the tool to look at green, vulnerable neighborhoods. You know, you can redo the settings. You can look at health by looking at asthma and social vulnerability and PM. Or you can look at climate change, the urban heat islands and traffic volume. And I think that's...
All right, great, thank you. So let's go ahead and get into your questions, either about the tree tool or the other work that Riot has been doing, and then obviously COVID. Let me just get this switched over. All right. All right, so a couple of things here. So the News Knockout on Twitter is asking, why did you close the beaches if your guest says being in nature is healthy? So let me sort of start with that, and then please feel free to chime in. So not sure which point you're talking about. Occasionally beaches are closed when there is high contamination in the water, and that is actually done in conjunction with parks. If you're talking about early on in COVID, where we actually shut down some of the outdoor spaces, that really had to do with the fact that they were major gathering spaces, and at that point we did not yet have the data around that these outdoor spaces can, are significantly lower risk. What we did have were a lot of gathering along the lakefront, not surprisingly, as people were going out. And so if you remember, for probably the first 6-9 months of COVID, we were very much encouraging people to go out and go into nature, but to try to do that in a way that they were not having close interactions with other people. We certainly saw examples of spread, including in beaches and park type settings where we did not yet have any vulnerability. I'm very glad that we're at a point where most people are vaccinated. We're not worried about those outdoor gatherings in the same way. But we all along have actually been encouraging people to be outside. I remember that from even the earliest days of mental health. Do you want to add anything to kind of the being in nature is healthy part, or a little bit more about kind of connection between trees and health maybe?
Sure. Sometimes some of the studies people were seeing were just walking in their neighborhood in a tree-lined streets, so that was important. Or going towards where parks were, because you could walk around. You can still walk around the parks. So there was a study out of Northwestern that found that it decreased blood pressure. So it was a good way to decrease stress if you walked where their trees were.
All right, good. Boy, the News Knockout from Twitter is rating a lot of questions here. Let me just hit a couple of them real quick. Someone says, did you just say vaccines are available at McDonald's? They are at a particular McDonald's. We've actually seen some McDonald's, especially on the south side. There's a group of McDonald's, many that are Black-owned businesses who have really wanted to improve access to vaccine in their community, and they reached out to us. They've been offering free meals in a lot of cases, have really worked to make allow their employees to get vaccinated. And let me tell you, it turns out to be a good spot for people who maybe have not planned to get a vaccine but are coming through. If you think about people who tend to purchase fast food. Sometimes it's folks who may not have as much income to be able to purchase some of the more expensive options, and they are often in a hurry, and the ability to get a vaccine on site has really been good. So, we have not turned really anybody away who has wanted to partner with us on COVID. I will say it's probably a first for the Chicago Department of Public Health to be partnering with McDonald's in particular because, obviously there are some health concerns related to a lot of consumption of fast food. But on this issue, we want vaccine where people are and where we see people getting it. So I really thank that association that said, what can we do to help? And McDonald's, has actually done other things across the country in terms of promoting access to vaccine. And, anything that has worked here in Chicago to build that confidence and work on accessibility, I am interested in. So yes. Helen Rigi Stein on Facebook says, do children receive the same dosage of vaccine as adults? No. 5 to 11-year-olds, the dose is 1/3 the dose of what teenagers and older adults get. And that's because in the studies that were done, the same studies in terms of where you compare people who get the vaccine and don't, it's all volunteers. Those studies in 5 to 11-year-olds, they worked to really determine what was the most appropriate dose to give the same level of protection, but less problems with side effects. And so that 1/3 dose is the sweet spot. And it's been really good here in Chicago and across the country. Kids have, in the study, there were no children in that 5 to 11-year-old study who had any of that myocarditis or pericarditis that I know there was worry about. And generally kids here, including my own nieces and nephews, really had nothing. But the number one thing we've heard is no side effect, and the second is sometimes kids will have a sore arm. Even the sort of flu-like symptoms for a day or two, although it can happen, it seems to be happening even less than it does in the older kids, but the protection is good. So yeah, great question. Okay, so once you get COVID, this is Wendy Azizi on Facebook. Once you get COVID, when can you get the shot? Or do you even need one? So good question, Wendy. When you get COVID, you can get the shot anytime after you have recovered from COVID. So you should not get the vaccine in those first 10 days when you're still in isolation. This would be true for children too. But after that point, you can get the shot. The chances are for the first 3 months after you've recovered from COVID, your likelihood of being diagnosed with COVID is quite low. The natural immunity is good for those first 3 months. The problem is it falls off pretty quickly after that. And this is where I see a number of you are writing in about natural immunity, et cetera. I shared this a couple of weeks ago, a big study out of CDC that actually compared what was the risk between people who had, quote, natural immunity, had recovered from COVID, how likely were they to get a second COVID infection, versus people who had never had COVID, got vaccinated, but then had breakthrough COVID. And actually, people who were just depending on the natural immunity were more than 5 times as likely to get reinfected with COVID. The best protection, I've said over and over again, is people who both recover from COVID and get a vaccine. So yes, I would strongly encourage anybody, even if you've recovered from COVID, to get vaccinated. If you want to wait those 3 months, you can. The natural protection looks quite good for the first 3 months. But honestly, when people in my family, et cetera, I just encourage them to get it almost as soon as they can, just to build up some of that immunity. Okay, so there's a question here. Anthony on Twitter says, about trees, this is for you. My mother grew up poor, but moved to a middle-class suburb. She cut down the trees in front of our house. I wonder if she associated trees with gentrifiers. Do you see that issue in some poorer areas? Really, that's an interesting question, Anthony. What do you think about that?
Yeah, they call that greenwashing. Sometimes outsiders, or maybe gentrification in a neighborhood is increasing trees. One of the things that we're careful with in this initiative is working with the community. We're not going to make assumptions that we're going to come in and start planting trees, whether you like it or not. We're learning right now what's being done in Chicago, and it's amazing work by these community organizations, and we're learning from them. They're the ones closest to their neighbors and friends and family there. So one of the things that we're asking is, how can we elevate their work?
Yeah, and I've got someone else just writing in saying, if I work in this area, how do we get connected? What does this look like? Sure. Who are you working with?
Yeah, we're working with various community organizations from Blacks in Green, Lucha, Latinos Progresando, the Southwest Collective, the Muslim Green Team, Chicago Muslim Green Team, the Chicago Association Chinese Americans. Boy, I'm going to be missing out somebody.
That's
There's
all right.
more.
And putting you on the spot. Yeah,
and there are several in Imani Village. Mm-hmm. So there are several of these organizations that are also coupled with other conservation organizations. Like I said earlier, Open Lands, Chicago Region Trees Initiative, the Trust for Public Land, and the Nature Conservancy. But if you have an organization that does work on the ground and in the green space or on trees and working in Chicago, please, message me on Twitter or Facebook and let me know, because we would like to get these green organizations all working together with each other and learning from each other. That's one of the things that we're doing, is not just planting trees. We're looking at the maintenance of trees, preservation of trees, mm-hmm. the communication materials, how do we explain the benefits, but also job training and workforce development. Chicago has, through the Chicago Department of Transportation, the Green Corps. Mm-hmm. And so there's a lot of green jobs out there, and there's a high need, but not a lot of applicants. So how can we develop leadership and training through this investment? And so it's multifaceted. It's not just planting trees and going into communities. There's a lot of arms to this work. So please get a hold of me.
Okay, good. Let me get another couple COVID ones in. So I've got Anthony on Twitter here saying, it seems with vaccines, treatments like monoclonal antibodies and drugs like the new antivirals, good. We have a COVID toolkit. What planning is being done for this to become endemic as opposed to pandemic? Yeah, good question. So I talked a little bit about the antivirals earlier this week and last week, but lots of planning is being done. I was actually on a national call yesterday thinking about this. What does the distribution look? For those who haven't been following this, just to remind you, I am really excited about the possibility of having an oral, meaning by mouth, pill that we could have somebody take when they are diagnosed with COVID that would significantly cut their risk of being hospitalized or dying from COVID. This is something we have for flu. So there's a number of different examples. Tamiflu is one that's probably the best known, where if somebody is diagnosed with influenza very early on, when their symptoms are just starting, if they take Tamiflu, they really decrease their chances of hospitalization or death. And we've seen a lot of examples of people taking all kinds of medications during COVID here. But for the first time, both Merck and Pfizer have completed studies on this, which is something, frankly, I've been excited for. Neither of them are FDA approved yet. Merck got its trial data in first. Molnupiravir is the name of that drug. The FDA is looking at it. November 30, the FDA is going to be sort of doing a hearing, publicly looking at it. And then Pfizer is just a little bit behind. But the good news is that in the Merck trial, this was specifically for people who were diagnosed with COVID, were outpatient, so not admitted to the hospital, and you got to take it in the first few days of symptoms, really within the first 5 days. And it is a 5-day course of medication. But in the Merck trial, it cut the risk of hospitalization and death by about half. And then in the Pfizer trial, it cut it by about 89%. So this has the potential to be a real game changer. It's not, vaccination is still going to be the most important thing. I would always rather prevent disease than help limit its effects. But the possibility of having this available is something I'm really excited about, and I think it could be something potentially available as early as December if the FDA gives it the green light. Now, there's still questions. I think pregnant women, for example, may not be able to get these drugs right at the beginning, and I do think that they're likely to be distributed probably through Health and Human Services. There's conversations about sort of how they'll go through pharmacies, what the prescription will look like. This isn't going to be an over-the-counter kind of thing that you need to take. There does need to be some, medical or pharmacy education and information around it, but it really has the potential to make a big deal. Follow-up question here. So are the COVID pills only for people who are unvaccinated and get COVID, or can breakthrough infections take the pill also? Yeah, so the first studies were in people who were unvaccinated and who had a risk factor for severe COVID, but right now there are studies going on for people who perhaps are not as high risk for the severe outcomes and people who get breakthrough infections. So my guess is there won't be quite enough vaccine for everybody. Not vaccine, there is enough vaccine. Probably not quite enough of these pills for everybody. My expectation is that they will be available for people who are at the highest risk of severe outcomes from COVID, regardless of vaccination status, but we're gonna have to see, okay? This is where I'm giving you sort of a preview. The FDA, the CDC, everybody's gonna be looking at this and weighing in. But I'm excited about the possibility of having this. Right now, the only thing where people are getting sick is to be able to get the monoclonal antibodies, and you got to go to a healthcare setting. It's an injection. It's more expensive. There's a lot of barriers to access there. So really, really excited about this. And it can't come soon enough in terms of where I look at the winter here and really want to keep down the risks here. Okay, so we are almost at time here. A couple of you were writing in about trees, but not really. I've got someone here writing in saying you're talking about trees, but refusing to talk about funding a shelter plus care housing program at Heartland Alliance. I'm not sure what you're referencing. Chicago Department of Public Health does not fund a shelter plus care housing program, so I'm not sure what you're referencing. But the reason why we're really trying to emphasize the environment work is to, is to highlight that part of this is about how, during COVID, have we learned to, frankly, work a little better together as a city, across departments, use data, pull it together, work with community organizations, and then make sure that where resources are being put, they're being put all along. So I'm going to continue to have different guests from different parts of the Chicago Department of Public Health coming in to join, probably especially on Thursdays. We tend to get a lot of questions in on Tuesdays. It's a little quieter on Thursdays. People, I sometimes wonder about people who will write things on social media that they probably wouldn't say in person. So I see you, people who are writing in saying, what else helps with fresh air besides trees? No cloth on your blank face. Yeah, and what else helps with fresh air and controlling COVID is keeping the masks on inside. You can have your mask on when you're out of doors, to be clear about that right now. So I'm sorry that you are perhaps not clear about that, but we want you out enjoying trees, we want you out in the fresh air, and not only do you not need to have a mask on when you are outside, when you are in private spaces and everybody is vaccinated, you don't need to have a mask on there either for Thanksgiving, etc. My concern is folks who are unvaccinated, and my concern is at a time where we are on the increase. Let me tell you, part of the reason why Chicago, I think, has managed to, so far at least, avoid a lot of the worst outcomes and unnecessary deaths is because we've continued to do this. I want to stay open. I want to keep going to the theater. I don't want to have to put restrictions on. I don't want to have to do what Europe is doing right now, like going back to some of these lockdowns. Masks are a part of doing that. They're not here forever. We will be taking them off eventually, I am sure. If everybody were vaccinated, we'd be done with COVID, honest to God. So anyway, let me take one last COVID question, and then I want to give you a last word sort of on trees, and then we'll wrap up. Mary Cruz Torres on Facebook was just asking, is the booster half a dose or a full dose? Moderna is a half dose. Pfizer is a full dose. J&J is a full dose. The reason why Moderna is a half dose is because Moderna had a higher dose of the mRNA, the only active part of the vaccine, to start with. So it's part of why the side effects are sometimes a little higher in the folks who have Moderna. But what we recommend, my recommendation, get a booster. Someone else was asking, I'm 21, can I get a booster shot yet? You can if you are working in any sort of setting, or you're living in a setting, or you're gathering with folks that you're concerned about, or you have an underlying condition. We're not turning folks away. And I encourage anybody who got J&J, 2 months after you're getting that one J&J dose, you should get another dose of vaccine. If it doesn't matter to you which kind you get, I would recommend getting either Pfizer or Moderna. That's the protection there was a little bit higher in the crossover trials. Other than that, personally, I would stick with what you got the first time around. And if you felt strongly about getting J&J the first time, a second dose of J&J also brings your immunity levels back up well. So if you got 2 doses of Moderna, get a booster of Moderna would be my recommendation. If you got 2 doses of Pfizer, get a booster of Pfizer. But you can cross-match across those. All right, so thank you again. Red Munster, our Director of Innovation at the Chicago Department of Public Health. Lots of work behind the scenes on COVID, but also an example of, I think, the way as a city we're trying to take some of these COVID lessons, both about bringing resources where they're needed, using data, making it available. So please let people know how to contact you too. Someone was asking, how do I get in touch with your Twitter if my organization wants to be involved?
Sure, you can reach out at Reed Mansour. It's not spelled like it's normally spelled. It's REEDMONSEUR. Or reply to this and I'll look for the messages. I do want to give, I missed listing some people.
Okay.
I can't leave them out. North Lawndale Greening Committee, thank you. Illinois Environmental Council, thank you also. Lots of folks at CDOT and the Bureau of Forestry at Streets and Sanitation. I just want to say thank you all for the partnership. And this is still ongoing. It's relatively new. The budget was passed like a couple weeks ago.
Yep.
We just started meeting with the community organizations in late August. It's all brand new. We have done nothing yet with this. We're strategizing, we're planning, and we're talking. And hopefully when the weather gets warmer again in the spring, we can start that work and get out.
In terms of actually getting planting and stuff.
Yeah. So I do want to give a shout out to my wife, Selena, who's teaching second grade. She's not watching right now, obviously. I'll have her watch later. Please get in contact with me, and let's see what we can do to help the environment here in Chicago.
Yeah, absolutely. All right, thanks so much. So just a reminder, this weekend at pediatric clinics, lots and lots of availability. We want you to make an appointment, please. It just helps you not have to wait and us have enough vaccine. So Saturday at Kennedy King, 9 to 2, Sunday at Olive Harvey, 9 to 2, plus all over the city. And I want to just remind you that we will not be on next week because of the Thanksgiving holiday. I want to wish all of you a healthy and safe Thanksgiving. I told my team this morning that the #1 thing I am thankful for is all of them and the amazing work that the folks at CDPH have been doing. I mean, that they did before COVID, but really for going on 2 years now, just have stepped up in amazing ways, including ways that a lot of the public doesn't always see. And I'm really, really thankful for their professionalism and dedication. And my other thankful is for the vaccine itself. The fact that I can be traveling for Thanksgiving next week. I obviously have had both of my doses and my booster. So have the people in my extended family. And I don't have COVID on my high personal worry list. Certainly I'm concerned about the increases we're seeing across Chicago and even more so across the Midwest right now. But I remain so thankful that we have a vaccine that cuts that risk dramatically of getting infected, of being hospitalized, and of dying. And I know for more than 6,100 families in Chicago who have lost a loved one to COVID, the holidays can be hard. Thanksgiving being one of those. And I certainly feel for all of you. I feel for our city, and we do remember the folks that we have lost and continue every day. 4 Chicagoans dying every day from COVID still. And I hope that, in their memory, we can do everything we can to please try to not have so much vitriol, frankly, on social media. People are working hard, trying to do what is the right thing for getting our city through this pandemic. As open as possible, with as little loss of life as possible. Building trust is how we do that. And I thank the many of you that have stuck with us all along through here, doing all of these Facebook Lives and all of this outreach. We don't always get everything exactly right, but I can tell you, we have used the best data that has been available at every point. And we have made decisions that are trying to, from a public health perspective, protect the city of Chicago's health. And when I say health, I don't just mean physical health. I mean mental health. I mean economic health. I mean the ability to grow. And I'm really proud of the way that we have made it this far and the way in which we're learning how to take a lot of these improvements and different ways of working from COVID and want to work on them further. So thanks again, Red, for being part of that team, and thanks to all of you all over the city that have just continued to step up. I wish you a happy and safe Thanksgiving week. Bye-bye.